I'm talking to like one of my buddies or like my mom or something. And that way it's like more like conversational kind of, and it takes the focus off people. But you know,
thank you for the tip.
That's what worked for me, and it's been working ever since. So yeah, I definitely feel you though. My heart rate goes up for sure. Yeah, but I think it's a natural thing.
All right, and we're actually live, so Tiffany, you can go ahead and introduce the session.
Okay. Hi, everyone. Welcome back to another session with Pre-Dental Universe virtual shadowing session. Today we have an exciting presentation with Dr. Lan. And so, Dr. Lan, whenever you're ready, the floor is yours.
Awesome. Thank you guys for having me. I am Dr. Sean Land. And yeah, thank you for having me today. It's great that there's groups like this to kind of help pre-dentals and help pre-health students kind of like get more exposure to this kind of thing. Because with the COVID and not being able to shadow and stuff in person, it must be very tough for you guys. I certainly didn't have to deal with that when I was a pre-dental, so I feel for you guys. But yeah, anyway, you can click for the next slide. Do a little intro about myself. I was born in the north, Minnesota, but I grew up in South Florida. 305 people, what's up? So I went to undergrad in University of Florida, majored in nutrition, like Erica here, which we just talked about a little bit about. And then for dental school, I ended up going to UF again. So I'm a double gator. And currently, I'm serving with the United States Air Force, and I am in a one-year AEGD residency program. So here's just some photos from dental school, some of my favorite memories. We had like tailgates for football games. Of course, you guys know the Gator football is huge. And there's me and my boys on the right there when we got our white coat. Very exciting time in dental school. So next slide. I guess before I start, what are like kind of the main things that you guys are curious about? Because I can talk about like why dentistry. I guess I can ask the moderators this, because you guys have questions like flowing through. But I can talk about why dentistry, what got me into dentistry. I can talk about like a typical day in dental school, and what to expect, or really anything. So before I just go off rambling, let me ask that.
No, absolutely. Feel free to do so. Thank you.
Okay. So I guess a typical day in dental school, just to give you guys a little like insight of what that looks like. Your D1 and D2 year usually is very didactic heavy. So you're spending a lot of your time studying the basic sciences, like you're taking anatomy, physiology, biochemistry. I mean, all these classes that you've probably already taken in undergrad as a prerequisite to get into dental school, but just on a faster pace and higher level. And then you're also taking some of the hand skill classes, right? So you're taking dental anatomy, you're going to wax teeth. You'll get into operative dentistry, so you're doing like simple fillings at first, okay? And then some schools are starting to try to get you into clinic in the sense of shadowing and assisting the older students. And definitely by D2 year, you'll be in the clinics at least working on assisting, if not, doing pro fees or something. But that varies kind of school to school. And then D2 year rolls around, and then you'll be pretty much done with your basic sciences. You'll still be taking some like general pathology, histology and whatnot. But then you really start doing the dental sciences. So you start taking classes on endodontics, you start taking classes on periodontics, oral surgery, prosthodontics, you name it. So the didactic portion kind of splits between basic and dental sciences then. And then D2 is a super exciting year because that's when you start really doing all the bread and butter stuff, right? Like you got to go to the clinic or sim lab and you're doing, crown preps, bridge preps. You're learning how to do removable partial dentures, complete dentures. So like a lot more hands-on and it gets you like really excited because you're like, wow, I'm going to be, you're pretty much practicing for the patients you'll be seeing third, fourth year. So it's a very exciting time. It's a very busy time, but it's a very exciting time for sure. So then you roll into D3 year. That's a big transition year, once you start seeing patients and you're the main provider for that patient. So you're in clinic full time. You might have a couple classes, a couple credit hours per semester, but you're pretty much in 7 to 5 or whatever your hours for the dental school is. But you're pretty much in clinic full time. You'll see a patient in the morning from 7 to 11. You might have an hour and a half for lunch. And I say an hour and a half, I mean, you probably have like 20, 30 minutes to scarf down your lunch, and then you're in the lab doing lab work, or you're, doing patient admin work or studying up on something for, or preparing for a procedure that you're about to do in the afternoon. But it's awesome because you get to finally work on real people. And then fourth year, it's the same thing. But what I really want to focus on, most dental schools provided pretty similar experiences as far as the education. The point of dental school, if you take a step back and look at it, is to prepare you for, the fundamentals, the bread and butter, right? Your simple fillings, your single crowns, simple bridges or FBDs, and then your denture work. And maybe a root canal or two, simple extractions. So there's a lot more that you can get out of dental school if you seek it out. And what I mean by that is, yes, there's school and it keeps you busy, but also don't forget about the other stuff that you did as a pre-dental to get in, like volunteering. There's going to be lots of opportunity for you to go volunteer, not only as now just someone like a runner who's running to get some supplies, and not saying that's not important, but now you have the skill to provide dentistry as a provider. So as a volunteer, you're at that level, you get to help underserved people with your skills, and also like practice them at the same time, which is a great opportunity. Some schools have mission trips, so I would look into that. I would definitely, if your school offers mission trips or does mission trips, or maybe partners with a group that does those, highly recommend it. And definitely stay involved. Don't just stop and say, "Oh, I got in, that's great." That's I don't really remember the hours and hours I sat in the lecture hall. I remember going to the Dominican Republic and sleeping in the heat for 7 days with all my friends. And then we, providing care to people that really, some of them haven't even heard about dentistry. They just kind of expect their teeth to fall out, and that's what they expect. So you can do a lot of good and help a lot of people with the skills that you're about to learn, which is a very powerful thing. So I can talk on and on about it, but I've just included some photos of those things that you're able to do, or that I did in dental school, that I encourage you guys to do. Let me go to the next slide. So on the left there is the Freedom Clinic. So at University of Florida in our area, we have this nonprofit underserved clinic called the Freedom Clinic. The DOM stands for Dental, Optometry, and Medical. And so people literally are held about once a month, and they can get free dental, optometry, or medical care. And so as much as we could, you see everyone doing the Gator sign there. It's always a great Saturday. You roll in early. There's already people lined up, waiting for you to start working on them. And it's just a really fun day. At the end of the day, everyone's just talking about their experiences and this patient was so grateful for this or that, or the new bonds you make with the new faculty that are staffing you there. So you got to meet a lot of great people and have a lot of fun doing volunteering too. In the middle here is some of my dear friends in dental school. We were some of us were I guess we sought out each other because we loved music, and there was a fundraiser where we would go around on Valentine's week, for 2 weeks, and then you can order a song for somebody special, and you can go embarrass them. We'd have probably 5 or 6 songs, and you could choose one of the 5 or 6 songs, and you can have us deliver it to that person, whether it be in clinic, in morning huddle, or in lecture. and just really, show them, give them something special, and kind of embarrass them a little bit. So that was also fun. Next slide. So here's a big one. I was huge into ASDA with my boys in dental school, and had a lot of opportunities too. So I want to talk about a little bit, or take this moment to talk about organized dentistry and the importance of advocating for your own profession. So I don't know how it is now, but with the coronavirus, I know some schools are forgoing the live patient exam. But this has kind of been a big point of contention in the, I guess, academic world is, do we need a live patient exam to license dentists? And a lot of the argument for it is kind of historical. A lot of dentists saying, well, I had to do it. So of course, these younger generation have to do, class 2, class 3, and SR, skin and root planing on a live patient in order to prove that they're a competent dentist. And, whether that's a valid argument or not, that's just their side. But, if you look at a lot of other specialties, a surgeon doesn't have to prove that they can do surgery by, going on an exam, like a day of an exam, bringing a live patient and performing surgery on them, right? They prove their competency while in residency, while they work with their program directors and their attendings who watch them do the surgery and evaluate how they take care of their patients over time, and it's not just a one-day high-stress exam, which may not be your best day of dentistry. And so the importance, why I bring that up is because a lot, ASDA, or groups like ASDA and the ADA help fight for the things that that the students, like we want to get rid of these live patient exams. And so there has to be a group to help fight it. And so these groups, if you get involved, if you're interested, you can really help make a difference and impact the profession as a whole. So these are just a couple of pictures. We just, you get the opportunity to travel to different states. Well, this is before coronavirus. But yeah, you can go to the next slide. We went to Pittsburgh, California, New Orleans, and different places. And you get to meet a lot of different dental students from other schools too, and kind of talk about your experience in dental school and versus theirs, what kind of gripes they have versus yours. And then, you kind of like misery loves company, you kind of complain about things and kind of bond over that. But most importantly, you talk about, how you can help change your profession, which is awesome. So yeah, and then here's some pictures from the humanitarian trip we got to take at UF. One of the trips that we went was to the Dominican Republic, and we went to this place called Las Matas de Farfán, which is, I think, 20 minutes from San Juan. And it's really in the middle of nowhere. Like you see the picture of us loaded up in a truck on the right. That's literally how we would get to these different sites in the different villages. Everyone piles up in these trucks. You might see like the orange suitcase there. We pack up some suitcases full of instruments, get our propane tanks and burners for our sterilization, and we just ride out on the dirt road to these places. And you have to remember, like at places, some of these places, I'll never forget. So there's this one. I remember we went to this one village and we finished, performing extractions and cleanings for the day, and we were handing out toothbrushes and toothpaste, and we one of us handed it to this lady with her 2 kids, and she just looks at us and she says, "Okay, it's this," which means, "Oh, what is this?" And it was at that point where we realized, oh my God, probably nobody has taught her how to brush her teeth, so her kids obviously don't know how to brush their teeth. They didn't even know what a toothbrush was or ever seen one. And so that was a really oh my God moment for us, because we're telling all these people brush your teeth and all this, and just expecting them to know. And so it kind of really brought us back down to earth and kind of made us realize the impact that we could really make just by even going out and showing people how to brush their teeth, and showing people the basics of hygiene. So highly encourage you guys to go out there and volunteer and seek out these trips. And in dental school, every dental school is different, but most of the times you got to do extramural rotations, like your third and fourth year, which means you got to go out into different settings and practice dentistry. And so at our school at UF, we did 3 different community dental rotations where we went out to community health centers. Then we worked on the patients there. And so this is the first opportunity where you get to really, like, you have an assistant, you can hop room to room, and the pace is it's a lot faster than what you're used to in dental school. And so it's a really cool opportunity to do that. So yeah. Okay. At this point, so this is what I'm going to talk about residency, but before I move on, are there any questions?
We usually
Oh, sorry.
Sorry, but we usually leave the questions to the very end.
Okay.
Okay.
All right. So I guess I'll keep on going. So right now I'm going to transition to, that was dental school. Now you've graduated and, you're like, what do I do? And there's honestly a lot of different paths you can go. Okay. You can go straight out and do private practice. You can go and do corporate or do, if you have like a scholarship, like with the NHSC, like low, like community health centers and stuff, you can do that. Or you can go into residencies. And usually, typically third year, fourth year, you're really considering, answering the questions of what you like in dentistry and if you want to specialize or not. But if you if you really like doing it all and you're like, general dentistry is it for me, then I highly encourage you to do an AGD or a GPR program. Let me see. So let me backtrack one step and say, while you're in dental school, it's very important to kind of keep asking yourself the question of knowing your why. Okay, and there's this, you can look it up. It's called. I want you guys to go home or after this presentation and Google the golden circle. Okay, so it's literally just 3. I want you guys to picture 3 circles: one big circle out here, one middle circle here, and then a circle in the middle. Okay. And so the outer circle is the what, the middle circle is the how, and the middle circle is the why. And I would say from outside in, it increases in importance. So let's start with the what, right? In dental school, when you first start out, you're learning the what. You're learning your anatomy. You're learning your dental anatomy. You're learning what certain procedures are. Like what is a surgical extraction? What is a scaling root plating? What is a filling? What is a crown prep? And so that's what you start with, right? And then you kind of move in. You move to the how. So then you learn how to do it. So what steps? Step 1. You take your 15 blade, make a crestal incision on the alveolar ridge, and you reflect a full mucoperiosteal flap. Then you move on to and blah 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 blah. Right? So that's the how. So step 1, step 2, step 3. Then the last level is the why. And this is really what separates, in my opinion, us, the dentist or the physician level from the how and the what, right? Or a technician, right? Like what is the difference between a very skilled technician who can make arguably better than, me or any dentist, like beautiful anterior crowns or beautiful dentures, they're very good at the how, but what separates them from us is they weren't trained in the why, which is the diagnosis, right? It's us going in, interviewing the patient, meeting the patient, hearing their needs, right? You'll every single note that you'll do in dental school starts with patient presents with blank, and patient chief complaint is blank, and so that's the point of patient-centered care is you have to take into account what their problem is, and then us as the doctors, we're trained in the why, as in why are they having the issues that are going on, and then based on that, what should I do? What should I pick? What procedures should I perform on them in order to treat their problem, and then how do I do it, right? So these are like the three levels that you kind of compartmentalize like different kinds of information as you go along. So I think it's like a good visual for you guys. So sorry, went off that tangent. But what the reason I brought that up is because if you are satisfied with doing bread and butter dentistry and you're really that's all you want to do, then going to a specialty or going to even an AGD residency might not be the best move for you. In these residencies, like an AGD residency, you got to learn a lot of things that you don't get to do in dental school, like perio surgeries, third molar extractions, ortho, molar endo, and all that. And if all that's like, I'll refer it down to the specialist or refer it to a guy or gal who knows how to do it, then that's cool, But you really have to, it's really important to kind of find your niche in dentistry. Okay. So typical day in an AGD residency. So I'll say this with a big asterisk. I'm in a military program, so my experience is going to be a lot different from another person's experience from in like a civilian program. But I think in general it's the same or very similar. So typically I try to get to clinic at 5:30, and that's when I start working on it. I have an hour and a half before patients start at 7 to work on my patient management, do lit reviews, work on any case presentations that we have coming up, and do lab work. So, kind of similar to the stuff we have in dental school, but just, on another level now. Then we have patient care from 7 to 11, and I'll talk more about these in the next slide. Then we have lunch for about an hour and a half, doing the same thing. And then patient care again in the afternoon. And then afterwards comes the dreaded notes. There's lots of notes. Everything you do has to be documented properly, because the notes are really, they serve as, something that you can look back on and see what you did at that time, because you can't remember. There's no way you can remember like for every single patient that you've done what they did at the last appointment. And then two, it also serves like it is a legal document, right? So if someone comes back and says, hey, like so, you can pull up your note and be like, nope, we informed you of these risks. We gave you these alternatives to these treatments, and we discussed all that. And so it could also save your butt one day. And then after, like, I try to get out of there by 6 or 7, and then do my own thing. Go to the gym, relax a little bit, study and prepare for the next day. So you can skip this. This is more for like military, the types of patients we see in the military. So you don't have to go through that. Okay, so this slide is talks about all the different things that we get to do in the AGD and kind of the expanded dentistry that we get to do beyond the bread and butter that you learn in dental school. And so we'll start with operative, which is bread and butter dentistry. But so far, honestly, in the operative I've been doing in the residency, and all my co-residents have been doing, are like in dental school, we honestly probably would have extracted these teeth, just because one, at that level that you're not expected to be able to perform in like higher level operative dentistry, which is understandable. And we do explain to the patients for some of these cases, like, hey, like, this is a compromised treatment plan. Like, this is just to try to buy you 5 years, at best of time before you have to, do something else with it to maybe extract and get an implant, or another form of treatment. But it's really just a lot of these cases are, questionable in prognosis, and the important things that you let the patient know that. And so you get to learn a lot more complex ways to do operative dentistry and solution. It gives you a wider toolbox to kind of offer to your patients if they come to you like, doc, I really can't afford the root canal treatment right now. Is there anything you could do? Kind of thing. Prosthodontics, we get to do learning, even more about the fundamentals of complete dentures and removable partial dentures. And dentures really is, you'll learn in dental school. Like I would really, really focus on complete dentures, because they they really give the basis for occlusion. So a lot of the concepts that come out of dentures can be applied to occlusion, can be applied to aesthetics. Like if you guys are interested in like being cosmetic dentists, like doing veneers, setting up the anterior guidance and all that. The fundamentals are all there for complete dentures, and restoring implants, of course. The big one for me, because this is where my interests lie, are perio surgery and oral surgery. So in our AGD program, we get to do a lot of perio surgery. So your perio experience in dental school will 99% of the time be scaling and root planing, which is an important skill to learn for a dentist. But then after a while, you're like, okay, I got this. Like, that's, I'm ready to move on. But usually at most, you might, if you get in with the faculty and they can see your hard work, you might get to do a crown lengthening with them in the perio clinic. But in residency, if that's something that you're interested in doing or exploring, you get to learn a lot of these procedures. Like we're doing flap osseous surgery to treat severe periodontal disease. We're doing crown lengthening. We're doing aesthetic crown lengthening, which is like people have gummy smile and you go in and you reshape their gums. We're doing connective tissue grafts, free gingival grafts, and then even implants. So you get exposure to a lot of these things that you probably don't get to do a lot of in dental school. For oral surgery, you get to do a lot of third molar cases that are partially impacted or full bony impacted. Usually in dental school, they'll let you take out the ones that are fully already erupted. But the tougher cases, like if it's partial bony or full bony, usually goes to the oral surgery residents. But here, we have 2 oral surgeons that we get to work under, and they get to bail us out if we need. But it really gives us that environment to push ourselves and like take on these cases that, if I was in private practice, I wouldn't take on. But now that I've done a couple of cases, I'm like, well, now I feel more comfortable in taking out these teeth that I would never have considered taking out before, which is great. And then with the AGD program, you also get some exposure to IV sedation. There's a caveat with that. And I know there's a lot of oral surgeons out there that'll say, general dentists should not be doing IV sedations, which I honestly agree with too, to a certain extent. The type of sedation, you have to realize there's different levels of sedation. And the level of sedation that we're learning in AGD is at a moderate or conscious level. And that's not to say that it's nothing wrong could happen. You can have adverse effects happen for people on laughing gas or nitrous oxide, right? So there's always a risk whenever you're sedating someone. But most of the time, the level that we keep them at is a pretty safe level, especially if they're a healthy patient. So if you're interested in that, like this is something that a program can offer you. And of course, finishing off with endodontics, we have the opportunity to do more endo. Usually in dental school, you get to do anterior teeth and maybe a premolar, maybe a mandibular molar, but you'll never get to do like a maxillary molar. We'll feed it to the endo residents. But yeah, you get to do a lot more complicated endo with calcified canals, endo retreats, endo through a crown, maybe an apicoectomy or root end surgery, which is really cool. But all in all being said, realize that the point of this, obviously we're learning how to do the how, right? Again, going back to the circles. But the importance of the AGD is really the why, and giving us exposure to these cases really gives us a broad, much broader, more in-depth knowledge of certain, like when you should do certain things. Like, for example, if a patient comes in with a class 3 molar recession, what should I do for that? What procedures are indicated for that, right? And then it really helps you own in. I'm a learner by doer. So now that I've done like a lateral pedicle graft or an STT graft, I know that it's possible to do those, and I can treatment plan that. Now, at the end of the day, do I have to do all those cases? No. If I know, like, okay, this in my hands would be much more predictable than a periodontist, I can send it on to the periodontist. But if it's a simple, straightforward case and one that I know that in my hands I can do predictably, then I get to do those cases, as a general dentist. So while it is really cool that you get exposure on the how to do all these things, also keep in mind that the why and applying that to your treatment planning and for your patients is the most important. Okay. So this is a picture of me and my residents on our first run together. Honestly, like dental school, you'll be bogged down and you'll be like in. I mean, you guys know pre-dental life is pretty hard too. Like you'll be in the grind all the time, and you feel like you have no time for your friends or family. But honestly, like at the end of the day, that's really, I mean, it sort of really matters. Like what got me through dental school was having a good support system. Having friends to kind of commiserate or like just go out for a night and hang out. And yeah, you don't really remember all the nights of studying. You remember like, okay, I took this night off and I went out with my friends and had a great time. And then, yeah, we suffered a little bit the next day on Saturday, but hey, we still got our studying done. So yeah, that's it. This is a case. I guess I can talk about it really quick. I actually have to, sorry guys, I have to start heading out, but I will still be with you guys. I will just be kind of on the road. So feel free. I will stay on for questions as long as we can, but I will just be moving around now. So I apologize for that. But this is a case I did for aesthetic crown lengthening. And many of you guys probably have seen this procedure before, but I've never done it before until my residency, which is really cool. But pretty much you can see on the patient's right, so everything's flipped. So when I say right, the picture is like, if you look at the patient, it's the left. So the patient's right side, her central lateral incisors and her canine, and you can't really see too much from this photo, but it ended up being her premolars too, had excess gingiva or excess gum. So she had a gummy smile. And so what we did was, first, the most important part is diagnosing that, right? There's a couple different reasons why you can get gummy smile. That could be one, you just have extra gum, which means your gums they're growing like crazy. They're like, we like being here and we're gonna grow a lot. So there could be excess gum. Okay, so that's one of the reasons why. Another reason why you can get a gummy smile is that your skeletal growth, so your maxilla can actually grow in excess. So if you can imagine, your top jaw, your top jaw is growing down a little bit extra, and so everything, if your bone is growing down, everything's going to follow with it, including your gums. And so you can also get not necessarily thick gums or excess gum, but the appearance of that because you have excess maxilla. And there's a whole bunch of other reasons too that you'll learn in dental school. But my reason for bringing that up is, that's the most important step of even of approaching this type of patient, right? Because so in this case, the patient did have just excess gum, okay? But if she had another issue such as vertical maxillary excess or ultrapassive erosion or something else, this might not be the treatment plan for it, because we might do this procedure, and if it had a different underlying reason for why it was there, then the procedure would, if the procedure is not indicated, then this would have not been the best for the patient. It would have been a waste of our time, and it would also be a waste of the patient's time. Not to mention, you just put her through a surgery for no reason, right? So that's why we really want to harp on the importance of the why. So in this patient's case, it was just, her gums just love growing. So the treatment for that is something that we can call, or that's something that we call aesthetic crown lengthening. So we can go to the next slide. So pretty much what you do, you go in there, you make your measurements. Obviously, we had pictures and her casts all printed out and laid out. And so I made all my measurements. And in my treatment planning portion, and then on the day of surgery, you go in and you do what's called bone sounding, which is you take a probe and you literally, you stick it through. Well, obviously everything's numb, but you stick it on the gums of where you're planning on making your incisions to kind of measure, one, the pocket depth, and then two, kind of give you an outline of where to make your incisions. And then once you're happy with that, you go ahead and you make your incisions. And what you are seeing here is us after the incisions reflecting the gum tissues up a bit, okay, so that we can remodel the bone underneath. Because in some cases, or most cases, you can remove the gums, but the bone is really what dictates where the gums go. So if you just only remove the gums and she has excess bone, like that gum, you're gonna suture everything up, and you're gonna come back in 4 weeks, and the patient's still gonna have a gummy smile because you didn't remove enough bone. So remove the bone and kind of re-approximated all the gum tissue back to where it is. And then on the next slide, you can see our result. So she still had her sutures in. This was the 2-week follow-up, and I felt like she still needed her sutures in. So I apologize. You can still see the sutures there, but you can see like there's a big difference in her smile now. And she was like, this procedure I love doing because like the look on the patient's faces, even right after surgery, like they are so like, oh my God, like you know, I mean, you notice your smile the most out of anyone, but she like just the look on the patient's faces when you show them their smile for the first time is like it makes you feel so great, and so happy that you could do that for the patient. So it was an awesome experience for me too, because I was like, that was the first time that ever happened to me, and I was like, wow, this is really 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 cool. So yeah, I don't know if I had another case in there. Is there? No.
Well, thank you so much, Dr. Lan, for your amazing presentation, and that's a pretty good case for a first time.
Oh, thank you.
Yeah, it looks really good.
Thank you.
If you don't mind, we're gonna answer a couple, take some questions.
Yeah, of course.
So our first question is, do you find your own patients, or will the school assign them?
So in dental school, you will a little bit of both. So you usually the school has like a program, and patients know about it because they know it's reduced fee dentistry, and pretty much they're paying with their time, because it'll take us. We're a lot slower than a private practice dentist who can do it. But arguably, you know, the quality of work that you put out is sometimes just as good or even better than some of the private practicing folk, because you have all the faculty looking there, and then you are spending all that time, you know, doing that dentistry. So a lot, you know, you are providing quality care for your patients. It just takes you a little longer, which is normal for just starting out. So yeah, usually most schools will have patients for you, and like, you know, there's a like a clinic, like a screening clinic that you can go through, and or that patients go through, and they kind of assign them based on your needs. So if you say the school's requirement is 5 root canals for every student, right? They'll try to the best of their ability to try to get you patients, or keep a tally of how many root canals you've done, and then assign, if you need one, they'll assign you one. But then there's also a part of responsibility for you to kind of follow up with them and be like, sorry, I forgot something. But you have to kind of advocate for yourself too, and because it's hard to keep track of that many students. So usually you'll email your like treatment coordinator or your patient coordinator, like, hey, I still need these procedures. Like, can you find me some patients? Hey, sorry. Can you find me these patients to kind of add to my schedule so I can get that experience and fulfill that requirement?
Thank you, Dr. Lan. And the next question is, how did you balance your time during dental school with all your activities and being like involved in ASDA and the mission trips?
So it was a difficult process for me, learning how to balance my time, because I was definitely very gung-ho in the beginning and just only focusing on my academics. And it kind of took a toll on me. My first year at dental school, mainly like the first semester, all I did was study. I gave up the gym. I used to work out like 4 times a week, and that was like my way of stress relief. And I stopped working out. I would only go like once a month, even sometimes. and it just wasn't good. Like my body definitely knew that something was up, and I wasn't sleeping well. My energy during the day wasn't as good. My focus was off, and yeah, I was just getting really stressed out. And so you kind of just have to make time for it, right? Literally schedule, like if you guys are into like the planners, which I highly recommend. I used to do time blocking. So I would literally like put, wake up this time. I'm at school for this time. Obviously, you can't change that. But then after school, I'll put like, okay, I get out of clinic at 5 to 6, do lab work. After that, 6 to 8.
Yeah, we're here. I think that maybe you might have to switch from Wi-Fi to cellular.
That's it when you get things.
Oh, we lost him. Oh, he's back.
Hello?
Oh, yes, we can hear you now.
Can you hear me?
Yeah, we can hear you.
Okay. Sorry, I think I just lost connection to my Wi-Fi, so it's being busy. But yeah, you literally just have to make time for it. Yeah, I used to think there was like a secret way of doing it, but literally all it is you just have to, prioritize certain things and make time for people, make time for yourself.
We have a question in the YouTube chat. Tiffany asked, do you have any advice for pre-dental students interested in HPSC or working in the Air Force Army as a dentist?
Oh, of course. Yeah. That's, yeah. So, advice as in how to apply or like why I did it?
Yeah, I think more just general advice is, you were mentioning earlier your why and what made you ultimately decide to pursue that route.
Right. So the main reason I didn't apply for the 4-year because before I was like, I don't know if I want to do military. I don't want to get deployed, blah, blah, blah. But then I was like, well, I mean, realistically, if I'm in the Air Force and the Navy were the main ones I considered just because I had friends that went through those programs, so I was more familiar. Army is great too. I just didn't have any connects through there. But, I came to realize, I was like, well, if I'm a dentist in the Air Force, like, to deploy me to fly a plane or do this or that, like there's no way. So yeah, there's still a chance of getting deployed, but it's not nearly as high as say like the Army. But so that's what was really scaring me. But then I realized it's really cool to be able to travel the world and work in a lot of different places. Like there's bases all over the U.S. There's bases all in Europe, like 2 of them in Germany, 2 of them in England, 1 of them in Italy, and then in Japan there's a couple. Guam, there's some. Like there's some really cool places and locations in the world that you get to work at and live in. So if that's for you, it would be really cool for me. I mean, one of my goals is to get to a base in Germany so I can, just live there for 2 years. It would be such a great experience, So that was another factor. So location. And and you can look at it the other way too, right? And this is why I don't say pros or cons, because someone's pro may be a con for somebody else, right? Like I don't have any kids or a family, so moving around to me at this point in my life is a pro because I want to see different parts of the world. Like that's exciting to me. But like one day when I do settle down, have kids and whatnot, like that might not be a pro for me anymore because I don't want to dislocate my family like that often. So that was another reason. Another big reason I chose the Air Force is because straight out of dental school, I've just talked to a lot of my friends who are new grads, and it's tough. I mean, it's tough whatever path you go. But it's tough in the sense that, you know, when you graduate dental school, you're slow. For you to do reasonable dentistry, clinically acceptable dentistry, and make enough money for you to pay the bills, pay your assistants, and whatnot, is tough. It's really hard. And so, and at the same time, you're brand new. You know, you're still learning how to treatment plan patients properly, and still working on your hand skills. So there's a lot of things to worry about when you first get out of dental school. And so I would say, no matter what you do, mentorship is huge. Try to find, if you go private practice, try to find someone that'll mentor you, who's willing to. And there's not a lot of people that are willing to take the time to do that. So it's hard to find that. But if you can find someone that's willing to slow down their schedule in order to kind of, come just like dental school, come in and check it out and give you advice, that's ideal. That's awesome. And that's the main reason I joined the Air Force, is because they offered this residency in which I don't have to worry about, I have 5 patients or 10 patients in the morning that I have to do operative on, and then I have 5 more that I'm seeing for exams and hopping room to room, all while trying to, learn dentistry, learn how to do real world dentistry. So in the Air Force, we're allowed at least in the residency, I see 2 patients in the morning, 2 patients in the afternoon. And I really get a focus on what I'm doing and spend the time on learning how to do it properly, without any of the external stressors of, am I making enough money? Am I producing enough? And, oh crap, I have, 10 other patients in other rooms that I have to see. So that was a huge plus for me. So there's that. And then the education portion of it, obviously I didn't like bread and butter dentistry. I wanted to do some more expanded stuff. So the Air Force offered that as well with the AHD. And yeah, that's pretty much the main reasons that I chose the Air Force.
Can you describe how the HSPS program works and how the application process works as well?
Yeah, sure. So the way it works is pretty much you get 1-for-1 payback if you get accepted. So 1 year of dental school that you serve, or 1 year of dental school that they pay for, is 1 year that you have to serve. And the caveat is this. You have to serve for the military in general. The minimum contract that you can sign up for is 3 years. Okay. Currently, most of the branches offer 2, 3, and 4-year programs, and that's all based on need. Okay. So some years, if they don't need as many dentists or as many of this specialty, they're not going to offer, say, the 2-year program or the 3-year program. They're only going to offer the 4. And vice versa. They might increase the number of 2-year scholarships if they need more dentists, per se. Okay. So there's not a guarantee that every year they're going to offer the 2-year, the 3-year, or the 4-year. Some years they won't even offer the 4-year. They'll only offer the 2-year or 3-year. So that just all varies. But they're all the same. I was on the 2-year program, or 2-year scholarship. And so you might ask, well, they only paid for 2 years of your dental school. How does that work if you have to pay them back 3 years? And so with the Air Force currently, and this is also subject to change, usually your residency year, if you do a residency with the Air Force, it's neutral, meaning it doesn't count back towards your payback, right? So using that logic, I would spend 1 year doing the residency and 3 more years serving, my time in the Air Force, so a total of 4 years. But for when I applied, they kind of changed the rule where I only need to serve 2 years after my residency. So essentially, I am paying back 1-for-1, what they paid for, or the 3 years. So I'm doing residency, which is a neutral year, and then I'm paying back 2 years for the 2 years that they paid for at my school. Does that make sense?
Yeah.
Yeah, Yes, thank you
Okay.
so much, Dr. Lin. And would you say that your experience at UF, you had enough exposure to the clinical aspect of dentistry?
Yes, for sure. Let me say this. In dental school, I think in general, in dental school, and this is a topic of conversation right now too for dentists and dental students in general. I think the way it's trending um, is that the tuition keeps climbing, and especially with like now COVID and like so many people wanting to join, the tuition keeps climbing, the class sizes keep getting bigger, and the what suffers is the patient's experience, right, or the patient experience that you get. So the more people you have, that might affect the faculty to student ratio, and that might limit. I don't want to say limit, but it'll change the experience that you have, right? Um, so that is a big issue that I see right now, and all these opinions are my own. Okay, but yes, like at UF, I felt like I was very prepared coming out of dental school. I would have felt comfortable doing what bread and butter dentistry. Simple fillings, crowns, dentures, like just simple extractions. Bread and butter.
Thank you, Dr. Land. And the next question is, did you ever consider specializing? And if not, what deterred you from doing so?
So I did my second year of dental school. I really started enjoying oral surgery a lot. I really started enjoying oral surgery, and that was kind of the specialty that I really stuck with. And so I went on, I took call with oral surgery. I went on a couple externships, and that's mainly where my interests lie. Right now, I'm still deciding between the two, and I'm lucky in the sense that I get to do this AGD because I get to see, the other aspects of dentistry, and actually do them, mainly perio surgery, and then and some more advanced prostate cases. But for me, dentistry is awesome. Dentistry is like a great passion of mine. But in the general scheme of things, like in my life, like I have other interests and things I want to do too. And so when you're deciding on your own path, you have to kind of it helps to step back and not only look at what do I want to do in dentistry. You can still take a step back and ask yourself, like, what do I want to do in general with my life, right? Like dentistry can be your whole life, which is awesome. Like there's some people that's what they want to do. That's what they want to excel at, and that's what they want to put all their time and energy into. And other people might, still want to do just as good, but have other balance, like family time or travel, open up another business, stuff like that. So that also plays into your decision of whether to specialize or not. And so that's kind of where I'm at now, is kind of seeing if I like general dentistry enough to give me enough career satisfaction. And if not, if at the end of these 2 years, I'm like, like I really like oral surgery is it. I'm not feeling the passion anymore going to the clinic and doing, crown prep or bridge prep 12 to 14. I'm just not feeling that passion anymore. Then I'll go and specialize. That's how you'll know. And don't rush this decision. You kind of just let it come to you, and just by doing, just take it day by day, and really feel it out.
Thank you, Dr. Land. So unfortunately, that's all the time that we have for today for questions. And we just wanted to thank you so much for taking the time to answer all of them and for joining us today. And for those of you guys who attended today's session, the link for the post quiz will be posted in our group me. And yeah, thank you again, Dr. Land, for your time.
Yeah, of course. Thank you for having me. And if anyone wants to read or has any more questions, I'll shoot Veronica my email, and we can connect there. So if you have any more questions, feel free to ask.
Sounds great. Thank you.
Awesome.